I'm going to hit the record and turn it over to Kate.
Good afternoon, and welcome to Extreme Heat 101, Resources for Municipal Planning. As Phoebe mentioned, I'm Kate Adams, and I'm a climate epidemiologist in the Bureau of Climate and Environmental Health at DPH. And joining me today are Casey Gonzalez Gomez, who is a health equity coordinator in the Division of Community Engagement, and also Mandy McNeil, who is an environmental analyst in the Bureau of Climate and Environmental Health. Thank you for joining us today.
On warming, I think.
Next slide, please. These are the topics that we will be covering in today's presentation. How is heat changing in Massachusetts? How does heat-related illness happen and who is at most risk? What are signs and symptoms of heat illness and how can we prevent it? What are our heat equity communities and what heat resources does DPH have for communities and local governments? Next slide, please. There is no question that extreme heat can be dangerous for our health. Across Massachusetts, the frequency, duration, and intensity of heat waves has been increasing in recent decades and is getting worse by the year. As the climate warms, hot temperatures will continue to spread across more of the year and may lead to more emergency department visits. Next slide, please. I'm briefly showing you this slide so you can understand the color coding in the graphs of temperature and heat-related emergency visits in the next two slides. We created this system to help understand risk at different levels of heat based on the patterns we found when we looked at daily high temperatures and emergency department visits over a number of summers. Mandy will be going into greater detail on these categories and how we use them later in the presentation. Next slide, please. Last summer was definitely one for the record books. Here is a snapshot of how heat looked in the summer of 2025. This chart shows dots for the daily maximum temperature for each day from May 1st to September 30th. See the left-hand scale for the scale. And the solid line shows the number of heat-related emergency department visits for that same day, according to the scale on the right-hand side. We assigned colors to each temperature dot according to the categories that I just showed you. We had a historic first heat wave in June, and overall, it was a really hot summer. There were 6 events where the statewide average high temperature was over 85 F for 3 or more days, as shown by the relentless run of red and yellow and orange dots from late June to mid-August. June 24th, 2025 was the hottest June day on record and the 4th hottest day in history. Next slide. To give some sense of scale for how much worse last summer's heat was than previous summers, this is the 2025 season graph using the heat-related emergency department visit scale that we have been using for the previous 8 years. You can see those smaller heat waves looking a bit more important now. They were just dwarfed by how dangerous the record-breaking June 21 through 25 heat wave was. Overall, there were more heat-related illness visits last summer than in recent years. Next slide. So what happens to our bodies when it gets hot? What leads to all of these emergency department visits? These are the mechanisms our bodies use to stay at a consistent temperature between 97 and 99 Fahrenheit. We produce a lot of heat just from digesting our food and from moving around. That means that we need to have an environment that is cooler than we are to stay at a safe body temperature. When it gets hot out, our bodies respond in a couple of ways. First, the brain senses rising body temperature and tells the body to start cooling responses. These cooling responses mean that blood vessels get bigger to move more blood through the body and skin to release heat. and we start sweating more heavily to help cool the body through evaporation. When these two things happen, that heart works harder to move blood through the body and maintain our blood pressure, and the kidneys work harder to maintain fluid balance. Heat becomes a problem when our bodies struggle to keep up. This is because high demand for blood flow can strain the heart, and loss of fluid and electrolytes to sweat can stress our kidneys. This is also why medications that affect our circulatory system and renal function can reduce our ability to cope with heat. Next slide, please. So, who is most vulnerable to high levels of heat? Older adults, pregnant persons, and young children have reduced physical ability to cope with the heat because their bodies have a harder time cooling down. People with chronic medical conditions like diabetes, high blood pressure, asthma, COPD, heart disease, mental illnesses, or who take certain medications that interfere with their heat response are more vulnerable to heat. People whose living conditions and situations limit their cooling options, such as an inability to afford air conditioning, social isolation, immobility, lack of transportation to cooler locations, or low literacy, among others, are less able to respond to heat waves or escape the heat. Finally, people who work in hot environments, such as outdoor workers and people working indoors in hot conditions, like foundries or kitchens, have a lot more exposure to heat, raising their risk of heat-related illness. All of these physical, demographic, and social factors contribute to heat-related illness. Next slide. So what does heat illness look like? It progresses through three main stages. The first and least dangerous is heat cramps, where heavy sweating can lead to the depletion of electrolytes, and this causes muscle cramps. Cooling and hydration often relieves these symptoms and keeps them from progressing to more dangerous illness. Next slide. The next level of heat illness is heat exhaustion, where someone has overheated to the point of being tired, weak, clammy, and even passing out or throwing up. Hydration and moving to a cool space can help, but it may be time to go to the emergency room if symptoms persist or get worse. Next slide. Heat stroke is the final and sadly often fatal stage of heat-related illness, with high body temperature, headaches, seizures, confusion, and even unconsciousness. This is an absolute emergency requiring immediate medical intervention and actions to cool the body. Next slide. Fortunately, there are ways to prevent heat-related illness from happening in the first place. The first and most important is to recognize that summer is coming and heat is going to happen, and to be aware of and ready for heat events. Some ways to prepare before it gets hot include signing up for weather alerts and having a plan for transportation to cooler environments, power outages, and medication adjustments. Once a heat event has started, there are still many ways to prevent heat illness. Finding and staying in cool spaces is the most effective. Drinking plenty of fluids and avoiding being outside during peak heat hours is another, as is taking a cool shower, slowing down, going swimming, and staying alert to indoor and outdoor heat conditions. With that, I'll hand it to Casey from the Division of Community Engagement, who will talk about what DPH is doing for our communities in heat. Next slide.
Hey, hi everyone. My name is Casey. I am one of the health equity coordinators within the Division of Community Engagement at the Massachusetts.
God's sake, speak up.
You cannot hear me? Is my audio okay?
Yeah.
Yep, thank you. So yeah, thank you, Kate. So for this part of the presentation, I'm going to be talking about the different heat equity in Massachusetts communities. So DPH is concerned about unhealthy heat and health equity. So there is a strong evidence that risk of heat illness is congruent with certain social and economic factors. So on this map, you can see the different communities with the highest rates of heat stress emergency department visits from 2017 to 2021. In the dark orange. Also shown on this map is the thick black outlines. Those represent the different 37 heat equity communities across the state of Massachusetts. A city or town is considered a heat equity community if one, it has had a high number of rates of emergency visits for heat illness related illnesses, and also at least 50% of its population lives in an environmental justice community, or it's an advancing health equity in Massachusetts designated community. In addition, within this map, you can see the different communities are a part of this map. You'll see urban, rural, coastal, and inland. And they all include a wide range of populations and needs. So by identifying these communities, DPH wants to focus on equity, making sure that there's enough resources are going in the communities that they're most needed. In order to better protect people from different heat-related illnesses. So some communities, some heat equity communities to note are Athol, Holly, Monroe, Orange, Rowe. Next slide, please. So this past season, this past heat season, we launched the Community Heat Alert. So this is a heat alert system that we've launched to make sure that different community-based organizations and faith-based organizations are in the know when an extreme heat event is happening. So this is when more than 3 straight days of high temperatures of 85 degrees happens. So these alerts, in addition to the HON alerts, which go out to different providers and hospitals, allows community members and community organizations to know that a heat alert is coming out. So these alerts provide different tips for people to stay safe during an unhealthy heat event and different links to different resources that can help them be aware of different community safety tips. This alert is also translated into different languages and has links to resources on our mass.gov website. Next slide. Thank you. So this heat alert system, you are able to opt into it. So we have a QR code on the side of the presentation, so you can, in real time, if you're on your computer or laptop, you can grab your phone and open the camera app, and you're able to scan the QR code if you'd like to receive those heat alert systems, heat alert alerts during the summer, along with 280 other organizations and community members this heat season. So I'll give some people some time to scan the QR in order to sign up if they are interested. So in addition to some of those heat alerts, we also send out messaging with bite-sized educational resources. So you won't just receive the heat alert, it'll also be additional resources as well throughout the summer, depending on what is needed. Thank you. And next slide. Perfect. And I'll pass it over to my colleague, Mandy.
Hi, I'm Mandy McNeil. I hope everybody can hear me okay. So I'm Mandy McNeil. I work with Casey and Kate at the Department of Public Health. I specifically work in the Division of Environmental Toxicology as an environmental analyst. And I work a lot on the resources that we create for extreme heat events. So I'm going to take a minute to walk you through some of the resources that we've created that are new as of last year and like the last 2 years, really. This is all pretty new stuff. So to start, Here you can see the extreme heat landing page. This is something we created last year, and this is sort of the go-to for all things extreme heat, including our unhealthy heat forecast page, which I'll get to in a second. Here to the right, you can see a snapshot of our extreme heat resource guide. This is an extremely comprehensive guide to all things extreme heat. I will navigate this page at the end to show you where to find this resource, and others. But I just wanted to highlight it here because it's a deep dive into the work that we're doing on extreme heat, including the community messaging that we're putting out. So we'll take a closer look at that in a second. I'm driving the slide, so next slide to me, I guess. Here you can see what our daily unhealthy heat forecast webpage looks like. This is a forecast system that we're using now. This is up at the top here. I don't know if you can see my cursor, but there's a blue banner that says there is no active unhealthy heat alert. When there is a heat alert, again, this is down here. If you can see the heat thresholds, these are what Kate showed earlier in the presentation. But when the temperatures are in the red, so this is 85 degrees Fahrenheit or above for 3 or more consecutive days, this is when we release an unhealthy heat alert. When there is an unhealthy heat alert, then this banner turns red and it says there is an unhealthy heat alert. What's really cool about this unhealthy heat forecast webpage is there's a widget. It's kind of hard to see here, but it says select city or town. So you can do the drop bar here and you can select your own city and town and look up the forecast in your community. So this is a great tool to bookmark and remember to come back to. I will say, I will show you how to navigate to this from our extreme heat landing page, but this page goes live on May 1st. So it's live May 1st to September 30th. So I'll show it to you, but it's not going to look like this yet. But on May 1st, this is a site you want to make sure you come back to. We also have climate and health fact sheets on mass.gov. I know this is a talk on extreme heat, but we do have a fact sheet on extreme heat. You can see it here on the right. But I would be remiss to not mention that we have 14 of these these climate and health fact sheets. They cover topics on poor outdoor air quality, wildfire smoke, cyanobacteria, mold, extreme cold, which sort of, maybe we're past that hopefully, but those fact sheets exist. I'll show you where to find them from our extreme, you can navigate to this from our extreme heat landing page. And I also just want to put a plug that each of these 14 fact sheets are translated into 15 languages. So they're formatted and they look nice, they're translated. These are just ones you may want to remember if you're going into the community or doing a tabling event or something of that nature. We have also created climate and health educational videos or trainings, if you will. So these videos are available on mass.gov. I'll show you where to find them in a minute, but there are seven climate and health videos. We have 4 case studies, one on extreme heat, which you can see pictured here, but we also have one that highlights vector-borne diseases, ticks and mosquitoes, recreational water quality, or outdoor air quality, and one more that I'm forgetting. But I'll show you where to find them. But I also want to just let everyone on this call know, because this may pertain to you, that these are also available on Train under the title Climate and Health Learning Series. I put the link for Train here, but if you type in Climate and Health Learning Series, this will show up and you can see a screenshot here of what it looks like. But you can take these through the Office of Local and Regional Health for continuing education credits. So I would recommend sharing them with people maybe in the community that are interested in learning more. But if you're a public health official or professional on this call and you need continuing education credits, that is also available on Train. We have also taken the 7 trainings that I just showed you and combined them into one comprehensive training that is in Spanish. This is now available as of like about a month ago on mass.gov. So this is kind of hot off the press. And we're excited to share this new resource. But this, I'll show you how to get to it on mass.gov, but you can see over here, there are the same interactive graphics. I'll show them to you in a second, but these same graphics for the 7 trainings that I showed you in English, they're here now in Spanish, and you can toggle back and forth between English and Spanish. So we're very excited to share this resource, and hopefully you can share this with your networks or anybody that might be interested in learning more in Spanish. Okay. So I'm going to go ahead and navigate. Please bear with me as I try to navigate to this and like do the tech behind the scenes. But before I do navigate to the Extreme Heat webpage, I just want to show you this image really quickly. This is our unhealthy heat forecast page when there is an unhealthy heat alert. So you can see here, this was a screenshot that I took on August 12th of last year when we were under an unhealthy heat advisory. You can see how the banner is red, and you can see like the heat threshold. So there were at least 3 consecutive days where there was going to be unhealthy heat. So this is what the alert looks like on that page. Unfortunately, I'm going to show it to you now, but there will be none of this because it's obviously not hot. So let me see if I can just click this, if this will work. Okay. All right, so when you go to our Extreme Heat webpage, you can see it's mass.gov /extreme heat. Here are some quick links, and this is what I'm going to show you. There's more information underneath, and if you're looking for more, we have more, but we'll just focus on these quick links for now. So right here, this really big picture is our unhealthy heat forecast page. So this is where you would come to look up your forecast and to see if there are any unhealthy heat alerts. Again, this is down until May 1st, and it goes again into the heat threshold so you can understand the temperatures and the color coding of those temperatures. But I definitely think this is something you will want to come back to as we start to heat up. I'm gonna come back to this one. I'm gonna go to prevent and treat heat illness here. This is what Kate was explaining earlier in the presentation. We do want people to know the signs and symptoms of heat illness, and we're gonna skip all that text and come right to our 1-page fact sheet. So here it is in a PDF. It's pretty. It's something that you can again share with the community or post somewhere where people can see, and I think these pictures were right in our slide deck, but this is our 1-page fact sheet on this, and I think it's an important one to share with your community. Go back. And then I'm going to go right into our extreme heat resources. We have a lot of resources in here right now. Like if you're interested in interventions for people that are, property owners or pool operators, there's stuff for farm labor camp operators, recreational camps for children, correctional facilities. But I want to point you to the extreme heat resource guide here. Again, this is one of our resources that has all the information we presented here today, the heat thresholds, if you're looking for more information, our unhealthy heat forecast page, if you're interested in heat equity communities and the work that we're doing around community engagement, it's here. And then further down, we have different messaging for the public and where to find more information. So I just want to point this resource out if you're looking for more on extreme heat. And then over here, we have our beach water quality dashboard. This is something, if you're headed to a public bathing beach and you are wanting to know if it's open, check here first before you head there to cool off. So this is something that, we want to make sure people know is available. It's something you want to check before you head to the beach. And then lastly, our climate and health page, linked right here with our extreme heat. I just want to point to our climate and health fact sheets. I'll just go to extreme heat since that's what we're talking about today. Down here at the bottom, again, is our PDFs. So these are the ones that you may want to bring to like a tabling event, but I just want to show you really quick all of the languages here that they're translated into. So if you're interested in Portuguese, for example, it's here. And this is for all 14 fact sheets in this table of contents here. So you can kind of get a sense of some of the fact sheets that we've created. And then right under the fact sheets are the videos that I showed you earlier. So here are our seven trainings, and they have these heat, like for example, for our extreme heat training, we have this infographic that's interactive, so you can click through it and look for more interventions and resources. Community-based organizations. So we've kind of have it broken down. And this is for the case studies. So poor outdoor air quality, oh, I did say all four of them in the presentation. Okay. Those are the four. And then coming up here is our Spanish training, just so you know where you can find it. And this is all 7 trainings in one, including the infographic that you can toggle between English and Spanish, but you get the same. So these are the resources that I just wanted to highlight for today, where you can find them. I'm going to try to toggle back here. Can you guys see the slide presentation?
Yes.
Okay. Yeah. Okay. Thank you. I'm not really a tech person, but
You're doing amazing.
here we are. Yeah. Thank you. So I think, just to wrap up a little bit here on extreme heat. Extreme heat is dangerous. It impacts health, but the more we prepare and the more we share, the better, and safer our communities reflect on extreme heat. And just like a couple of reminders, please sign up for our community heat alert. I know Casey shared the QR code. I'm going to share it again in the last slide. But also, reach out or share it through your social media channels and your networks. We would like to be able to get that community alert out to more folks. And also remember to check our unhealthy heat forecast page to stay informed and be prepared when it starts to get hot. And, if any of these resources, spoke to you or you think your community would benefit, please share them with your networks. And thank you for listening. These 2 QR codes here at the top will take you to our resources. And then this third QR code down here is our community heat alert sign up that Casey shared earlier. But I think we have plenty of time for any questions or thoughts that folks might have.
Thank you, Mandy and Kate and Casey. One question is in the chat, and other folks, if you want to put things in the chat. I have 2 questions from the chat. One is Nancy from Cambridge is asking about whether there's public information going out about the change in threshold of the 85 and 3 days.
I did put, this is Kate. I did put a brief answer in the chat, but I wasn't sure what you meant by the change in threshold. When we do see in the next 7 days that there will be at least 3 days of 85 plus heat, we do send out those community alerts. We also send out what are called the Health and Homeland Alert Network, which is much more technical alert to physicians, local health, emergency management, and others who are signed up through our Office of Local and Regional Health and receive those alerts for both heat and for other emergent situations. So I don't know if that answers your question.
Thank you. No, let me just clarify, and I do receive the hot alerts, but thank you for reminding us of all that. But what I meant specifically is that for a while now, we've been operating under the premise that it's going to be 3 days of 90-degree heat, consecutive days. And so since we are lowering this threshold, which, by the way, I'm very pleased to hear that you're doing, so let me know that this is just me saying, yes, I'm thrilled about this, but I think that there may need to be some sort of work done to communicate to the rest of us that, we're going to change our thresholds now. It's not the 90 days, it's going to be 85. And I think that that's going to be a shift. And so I think that, maybe it would be better, for example, Cambridge, we have an extreme heat communication protocol that we're developing. I mean, we're about to launch it in April. And I mean, we've been talking about the thresholds and looking at what you guys have proposed about the 85 and suggesting, should we do that or should we stay with Boston at 90? So I'm just thinking,
Right.
a little bit further out forecasting, no pun intended. But really thinking about how are we going to get everybody else on the same page so that we could have that
Right.
statewide alert that I know that you are all aspiring to achieve. So I hope that is clear. Sorry.
Oh, no, that's okay. Well, ours were basically derived from directly looking in and drilling down on the data on what temperatures send people to the emergency room in Massachusetts. And there was this clear the inflection, it's really kind of a hockey stick. And it's really low level up to about 78. It starts to transition, but after 85, it just goes way up very quickly. And so that's what we based our alerts on. Now, that's why we also call ours the unhealthy heat alerts, because it isn't an official MEMA alert, and it differs from the National Weather Service. But the reason we went ahead and did our own system, it's partly because we were working with the Resilient Mass program, which kind of called for as one of its goals to have a locally or statewide based system. But it's also because we know that there are differences between our database in Massachusetts and how heat hits Massachusetts versus these more nationally derived thresholds. So we're in the process of kind of working through that. We just got it launched last year, and so we're starting to try to figure out how we can either accommodate the differences or whether or not our system will eventually be adopted as more of a official state designation for unhealthy heat.
It's
I
very
just would
helpful.
I would just love to say though that you guys should be tooting your own horn, because this is like incredible work. And so, I think that a lot of us have been really waiting for that shift to happen, as it's snowing outside my window as well. But we've all been literally waiting, and the cognitive dissonance that goes on with like how we talk about heat has not really ever been addressed. And so this has just got me excited. So I'm just really, really happy that you guys are doing this, and I would love it. I think you should do more out, let people know that you've got this and you've got that data, because the data that you have collected is so rich and it's kind of wasted. So share it out with everyone.
Hopefully, starting today. Thank you, Nancy. Another question is there an easy, so first of all, can somebody put a link to the map of the heat equity communities in the chat? Because I think for people, you see the map go by and you're like, oh, wait, is that me? And then the other is there a social media toolkit as part of this? And this is actually just a question from me, because last summer when we had the high heat stuff, I had 5 minutes to post something on Facebook before the end of the day. I went scrambling all over your website. I love DPH. I don't love mass.gov.
Yeah.
I couldn't find what I needed in the 5 minutes I had to post something on Facebook. So
Yeah.
is there an easy way to find the high heat, pre-made high heat social media stuff?
Yeah, so we are working to have something like this, like some bite-sized messaging available for this heat season. So it is not live. That's why I didn't walk you through it yet. But we are looking to have something because you're not the only one that's asked for it. But this is a hot off the press. So I'll share that with you, Phoebe, as soon as it's live. But we are working to develop some bite-sized messaging that can be shared with your networks on social
Great.
media.
Wonderful.
Yeah.
Jonathan, do you want to unmute and ask your question?
Sure. Thank you. I was just curious where the temperature forecasts are coming from, like the value that you're using to determine whether it passes the threshold or not, and whether that's being individually evaluated for each part of the state, or is it like a general value that kind of encompasses the entire state?
I can answer that. They're being pulled from the National Weather Service has what's called an API that puts the data out there. They're gathered up at 5 a.m. each morning, and we process them to get our statewide population weighted average value. And that's the value that we use. It, skews towards the hotter parts of the state are actually the more populous parts of the state. The lower Connecticut River Valley and the eastern seaboard. But we also did some regional evaluation, or at least I did, where I looked at it county by county over a 5-year period. And we've also reevaluated it in more recent years with what is called our surveillance data, because we had been using a different data set to determine the thresholds. And we're finding that it pretty much holds that, we use the statewide population weighted value, but we've also found that the areas that have historically been hotter and are more populous are still hotter, but all of the different counties and regions, actually the rates of the way the cases go up and down with temperature, it's all pretty much the same across the state. And we think that maybe because the places that are historically hotter have a bit of a head start, and also there are places where it's easier for people to walk or take a bus to the library, whereas places that are now getting hotter, like the Berkshires, like the South Coast, those places are, even though they're still cooler than the other parts of the state, they also have, there's less ability for people to respond to that heat. So but overall, we have found that statewide population value really works for the whole state. And I think that's also because it's very rare that any place other than Nantucket will have any different weather than the rest of the state.
Very interesting. Thank you. I think that Sheila from Heath is asking a question in the chat that I think I asked you when we had our pre-planning meeting, which was how often do you recalculate the heat equity communities? And if you could just reiterate what one of you could reiterate what Casey was saying about what is defined. It's like a certain amount of hospitalizations or whatever it is. So can you just say that again?
It's the top. We took the top 25% of towns by the rate of heat illness, and for the rural communities like Heath, and we used the rural cluster designations, just so we could get enough cases together to see. So that was the first cut. So we have those communities, and we also looked at the communities that had. You'll notice that Springfield's in there and Worcester are in there, even though their rates are not that orange color, and that's because those communities have more than 50 cases. So sometimes that's a indicator that we've got kind of like a regional, health center. So even if their city rates are not that high, they might get inundated from neighboring communities. Like Springfield would probably take in people from Holyoke who were experiencing heat illness. But so that was our first cut. More than 50 cases in that 5-year period, or in that top quartile, more than 14.5 visits per 100,000. Then the next cut was, is this an AHEM community, or is this a community that has greater than 50% of its residents in what are called environmental justice block groups? And that was determined by, I believe, EEA, which is our Energy and Environment Directorate, which they put out, and that's based on census data. It's based on percentage of a population that is, an income, race, and English language fluency. So what we were looking at is a combination of high rates or high numbers of cases, and also what the sociodemographic picture was, either based on the EJ block groups or whether it was designated a advancing health equity in Massachusetts community. So that's how we put this together. And we're going to reevaluate it in 2027 because we're going to have by then we should have new rural cluster designations. We'll have new data on, census data, and we're going to recalculate, because we know that this is, particularly some rural areas are really changing over in terms of their population and also their health risks. And we're going to be able to track that. But this was basically our first cut. And we may also just go, instead of individual towns and cities in rural clusters, we'll look at the whole cluster as well.
Yeah, I think that might make sense. We have so much complexity here with
Right.
zip codes and stuff. So one other question in the chat was, to me privately, was a lot of the people here are involved in working on summer camps, working on licensing summer camps for the summer, whether that's nurses or health inspectors. Are there specific guidance you give? And I see some of our Western Mass Recreation Department folks on the call as well. Is there sort of specific guidance that you guys put out for summer programs at the different thresholds, like of activity changes or anything like that?
I don't know if we've gone so far as to recommend specific activity changes tied to the specific thresholds, but I do know that Terry Howard, who heads up that piece of the Bureau of Climate and Environmental Health that does advise recreational camps, she has over the last couple of summers put together specific guidance on preventing heat-related illness in summer camp environments. And I'm not sure how she sends that out, but I will refer that to her to make sure that information is getting out to summer camps and make sure that people look for it, because I know there is a guidance document for that.
Wonderful. Maybe we could send it out with the follow-ups to this email, to this workshop. Sheila, I saw your hand up and then back down. Did my zip code comment cover what you were going to say? Yeah, I love the rural cluster as a group instead. Probably makes sense. Okay, so we've talked about how the heat equity committees are designed. We've talked about summer camps, talked about social media. Does anyone have any other questions for how to make this treasure trove of resources useful to you in your work? It sounds like if we all sign up for the alerts, we'll be much farther along. Okay, I'm looking at you all, giving you the 8-second teacher pause to see if you have questions that you're not asking yet. And after that, thank you, Daniel. Okay, I would say then that we are probably all set.